To the KCCMHConnection podcast. Today I'm here with my guest, Krista Davis, a licensed clinical social worker, or LCSW for short. How are you today?
I'm doing great.
Enjoying the springtime weather?
Loving it. Not complaining at all. Don't miss the cold.
Same. So, Krista, can you tell us today about your path to become a LCSW?
Sure. So I grew up here in Stratton, Colorado, and started out more so going down the psychology direction, got my associates in psychology, and I actually had a professor that he was a psychologist, and he asked me, why are you doing psychology? And I told him kind of what my idea was of what I wanted to get to. And he said, well, you should switch to social work. So I did. Got my bachelor's and then did a couple years of working in residential treatment with teenagers in particular, and then went back and got my master's degree and worked several different varying jobs, worked in child welfare for several years, worked in the prison system for several years, and then I was actually working on going into my own private practice, and got a call from somebody that worked here that I've known for a very long time, and they were like, hey, we're kind of looking for somebody that maybe wants to start a behavioral health program. And so I was like, okay, I'll go for it. So that's kind of how I started here. I always wanted to kind of come back home and be close to family and close to the people that I grew up around.
So I'm assuming that your role in either child welfare or in the prison system is much different than what you do here?
Yeah, those looked very, very different. In child welfare, we kind of did everything because that's how it works out here. Learn to do everything, no matter what role you're in. So from, taking the calls to investigating the calls to following through with the case management, and whether it was in home or, out of home placement, we kind of did it all through. We also did adult protection. So yeah, it was kind of all of the things, and I was all of the roles with those. So it was a really good learning experience. Both of them were.
Also very eye-opening.
Very, very. Yeah, child welfare in both the prison system. Very eye-opening things. Things that most generally people now are more aware of things that are going on, but actually being part of them and witnessing them and working with the people that are within those systems, totally different experience and very, very eye-opening, I would say.
So tell us what your role looks like here.
So here I am I do outpatient behavioral health care. So, they kind of use the terms interchangeably: behavioral health therapist, counselor. So I do outpatient mental health therapy.
And where do you do that?
I do that through Park Health Clinic and the Stratton Medical Clinic, primarily.
So what does it look like? Let's just say I've talked to my primary care provider and we've determined maybe I could use some extra support. What's my next step? How do I get a hold of you? What's it going to look like when I come to your office for the first time?
Yeah, so you actually don't even have to talk to your provider, a medical provider, to see me. So you can just call and request an appointment. You don't have to have a referral. You can, you're more than welcome to. You just don't have to. And so typically when somebody is coming to see me for the first time, it looks very similar because I'm in the location of where medical is also provided. You check in just like a normal appointment. Then the first appointment always looks different than kind of what everything else after that looks like, because that first one is I need to figure out what's going on and what's influencing, the challenges that people are coming in for. What are, family history dynamics? What is the current dynamics of, what you're going through, right? And it's more of an assessment and evaluation is what that first one is. And then kind of from there, after that, it's more about kind of developing rapport, letting people get to know me, developing a plan of like, okay, what do we want to tackle and how do we want to tackle it? And it's really not about what I want to do. It's about what the other person wants to do. So because I think a lot of times people think like, well, the professional knows best. And well, yeah, I have some degrees and I have some life experience in working with a lot of things, but nobody knows you better than you. So you know what's interfering in your life. You know what the challenges are and what you're wanting to approach and what you're not wanting to approach. So it's really up to the individual on what they want to focus on.
And then you just kind of help them get through the obstacles that maybe are in the way of accomplishing goals or feelings that are keeping them stuck in one place.
Yeah. So, and that's the hard thing, is because the mental health is such a very, very complex challenge, because there are so many things that influence mental health, right? And so it's, maybe it's relationship dynamics that are the challenge. Maybe it's, we have 900 different stressors that are going on in our life, and it's like we have too much on our plate and we are having a hard time figuring out how to manage them all and juggle everything. Sometimes it's, I have so much emotional stuff going on, I don't know how to navigate these emotions, right? It's not that emotions need to be fixed, but sometimes we just need somebody to help guide us in understanding them, where they come from, why we have them, what they're telling us. So there's no one size fits all with mental health. Everyone is so different. And that's what I kind of like. It keeps it interesting.
Okay, yeah. How many patients are you able to see?
In a day?
Yeah, or like on your caseload, or
generally I try to keep it, because of the way the hours are kind of set up at the clinics. I generally like to keep it at about 5 a day. I leave room for one open space just in case somebody needs something a little bit more urgent and they call me and they're like, hey, how fast can you get me in? I like to have a little bit of wiggle room, and that's not always possible, but I try my best. So, how many on a caseload kind of depends. We try to keep it, try to keep it around 30, maybe, give or take. A lot. That's going to be very different for everybody in different mental health settings. There are some, especially where it's like sometimes, particularly you see it a lot in like community behavioral health settings, where their caseloads are astronomical just because of the kind of limits and restrictions and pressures put on them, and not to any fault of their own. It's just system struggles. So
do you is that something you've seen as a difference, like from your previous work to here, is that you're allowed to manage your caseload a little bit more and provide, I'm not going to say better, but like more individualized care?
Yes. So particularly, and obviously the prison system is not going to be the same as the community of mental health. In the prison system, when I worked here at the prison in Burlington just for about 8 months before it closed. And then I went to Lyman Correctional Facility. And so at Lyman Correctional Facility, I think they housed 920 or 930 offenders. And for most of my time there were just 2 of us, 2 mental health therapists for 900 people. So we didn't really get many opportunities to provide actual mental health care. I know that I might get heat from some people that work in that system, but truly I can't. If the bigger my caseload is, the less time I have to really kind of focus on what those needs are. And so having that experience of I'm doing the bare minimum just to try to make sure I check all the governmental boxes was really frustrating for me. So
I imagine, because it's not an easy field to be in, and I would assume many people go into this work because they have a heart for it and they want to serve, and so not being able to do that, I can imagine that feels very frustrating.
Yeah, and the prison system is so much more complicated because you have, it's not your everyday people, right? They're people with really complex histories, really complex personality types, really difficult mentally, environmental factors, and things that you don't typically see on a regular day-to-day basis, right? I mean, not that it's non-existent here, but you're not dealing with gang populations out here on the Eastern Plains. And so, and understanding those complex dynamics and how they impact people within that system loved it, that job. Fascinating to witness that kind of human behavior on that level, because it was things you don't see in the regular world. And so learned a tremendous amount about human behavior.
I bet that, do you think that that's like fundamentally changed you as a person or as a provider?
Definitely opened my eyes to a lot, because you see it in such a, it's such a like structured system, and at the same time very flawed system. I feel like we never get anything perfect. We're human beings, we're flawed, we're going to screw things up. So the government is no different. Right? And so seeing how sometimes how policy affects provision of care, and seeing how sometimes it was more important to check a box than it was to actually help people. And so that was very eye-opening and helped me establish more firm boundaries with what I do and how I do it, because nobody is responsible for my license except for me. And the government sure isn't going to care whether or not I'm doing what I need to do, in the sense that if they tell me this has to be done, 10 things have to be done, and they're all priority. I had a really awesome mentor that taught me that if everything's a priority, then nothing's a priority. And we're human beings and we can't accomplish everything all the time. And so learning to prioritize based on, what I as a therapist need to prioritize, what has to be done, right? The mental health emergencies are gonna absolutely always be priority, because those are potentially life and death situations. And so those are absolutely the most important. Whereas, something that is, behavioral health, head of the behavioral health needs a report done. Well, that report can be pushed to the side. It's not important, right, when I'm dealing with human beings. And so it really taught me how to be firm in making those kinds of difficult decisions.
So can you tell us about the types of patients that you treat? Do you treat all ages?
No. So I primarily see 13 and up. Right? So most of the lifespan. Yeah. The younger age groups, our therapy looks very, very different for them because of their developmental ages and needs and ways of communicating. And so it takes a lot more kind of specialized training to do child therapy. And it's just not a training that I've ever done. And so that's the population that I have to navigate with, finding somebody that can provide that care when there is a need identified for it.
So do we have any resources in the community for child therapy?
Yes. So there is, I'm not 100% sure. I think there are some resources at Centennial Mental Health for the younger ages. I'm not 100% sure because their therapists do change, and so I'm not sure who's providing that care at any given time. But there's also a private practice provider here in Burlington that provides child therapy, right? That play therapy aspect of things for the younger age group, and she's been a phenomenal resource for me. Because I do think it's something that's a definite need out here. And so having her as a resource and somebody that I can send families to, and I've gotten really good feedback from the people that I've sent her direction.
So we do have someone to refer children to if that need arises.
Yep, and she is a Medicaid provider, which is a big thing out here. We have larger population of Medicaid individuals, which has been a challenge for a really, really long time because for a long while we only had one resource for them to go to, and now we have a couple options.
And is it because just the way that insurance system works, that it wasn't covering behavioral health?
No, I think for the most part, as long as I've been a therapist, they've covered behavioral health. I think the challenge has been it's very complicated to become licensed and credentialed with Medicaid and Medicare.
To serve that
Yep, to serve that population, there's a lot of hoops that you have to jump through again. It's messy. Mm-hmm. And so a lot of private practice providers don't want to have to focus so much of their time and energy in just trying to get credentialed with Medicare and Medicaid.
I understand.
Yeah, it's a headache.
So what are some signs people might overlook when it comes to their mental health?
Some of the signs, early detection can be really, really difficult just for anybody. We live, especially out in the rural culture, right? We are do-it-yourselfers, mm-hmm. right? We're like, put your nose to the grind, just get it taken care of, do it yourself. We're very self-reliant people, right? So we have a tendency, just by the culture we grew up in, to minimize or dismiss things for extended periods of time. And so sometimes we minimize our own health needs, not just mental health-wise, but also, even physical health. And so it's something that, everybody has good days and bad days. Everybody has, their ups and their downs.
Just to clarify,
mm-hmm.
That's normal, right?
That is totally normal. Completely normal.
Wake up and you don't feel great.
Yeah, some days you're just like, I'd rather not today, right? Yeah. And that's normal. But if it's when it gets to being that's the case most days, maybe that's not normal, right? That maybe there's something going on that could use some shift in perspective, or maybe there's just so much going on that I don't know how to do this on my own, right? And it's not something to be ashamed of. I think about it, mental health is very much, there's been such stigma around it for so many years, right? Forever.
Like, there's a problem with you.
Yeah.
If you need mental
There's something
health.
wrong with you, right? And I think of it something like the brain is the most complex organ in our body, right? It is this high-speed computer system that we understand actually very little about. And so we know the most we've ever known about it, but we still have little understanding of exactly how it functions and exactly how it works. And so I think of it something like, if I break my arm, right, I'm not just going to try to fix that on my own. Now, there might be some individuals out there that are like, nope, I'm just going to wrap it in Ace Wrap and call her good, right? But I think it's something that if I break something in my body, or if there's something wrong in my body, I'm going to go to somebody who knows how to figure out what's going on and what's wrong with it and how to fix it, mm-hmm. right? And I think that's something that mental health professionals generally have a really wide breadth of understanding of how and why emotions work the way they work, how relationships work the way they work. Our sometimes past experiences are influencing our present situation. And so if I'm struggling emotionally or mentally and I'm feeling overwhelmed by things, reaching out to somebody who has a deeper understanding of it doesn't mean you're broken. Reaching out to somebody who has more information about the thing that is impacting me.
Mm-hmm. No, I love how you're rephrasing that. It's just that you're getting more resources. Help me understand this.
Yeah, and I wouldn't shame somebody who is going to a professional trainer to build muscle, right? I wouldn't shame somebody for going to the doctor for a broken arm, right? I just need to allow people to know that it's okay to struggle. It doesn't feel good to struggle. We don't like struggling. We don't want to struggle. Life is hard. Life is complicated. People are complicated, and there's nothing wrong with that. People generally aren't broken irrevocably, right? It's just finding what are the tools, what are the resources, what are the things I need to help make this all feel more manageable in life in general. And so that's kind of why I do what I do.
Do you think that one of the things that makes mental health challenging is that people do push it down for so long, and then they've maybe like created new patterns or tendencies that are hard to change because they've just tried to live with it for so long?
We can definitely do that. We are creatures of habit, so even bad habits. And so it can kind of become the proverbial like shaken pop bottle where the pressure builds and builds and builds. That pressure is going to release at some point in time, and it's not usually pretty. Right? It can get to a point where it has significant effect on somebody's life. And we don't want it to get to that point. But sometimes we unintentionally, right? Nobody intends to, fall apart. Nobody wakes up one day and goes, I really want to have a mental breakdown right now. Today's my day. Right? And so it's something that can sometimes build slowly over time, that pressure. And we get sometimes to a point where we're like, everything that I've been doing to try to manage this situation is not working. Mm-hmm. Right? And even though we don't necessarily know what to do different, so we keep kind of doing the same thing over and over and over, hoping that something changes. But, it's hope is important, but hoping something else changes in our environment or our situation isn't something very reliable. We have very little control in life. I can't control what other people do. I can't control, my work stress all the time. I can't control what's going on in the world. I have control of me and my response to what's going on. Yes. That's it.
Dang. And do you feel like that's hard to learn sometimes?
Very, very. Yep. As somebody who has generally have a type A personality. I like things to be very structured and organized, and I like to have a plan for things. There's certain things that I'm more kind of like, I can wing it, right? I can just go with the flow. But for a lot of people, that not having control, and if something disrupts or changes that, can be really disorienting and really kind of throw us off. And so learning to let go of some of that, let go of that control of things, can be work.
Yes.
Yeah.
For somebody that's maybe hesitant to ask for help, if you could just talk to them right now on the camera, what would you say? Somebody that's just knows something needs to change. What would you tell them?
I would say it's okay to not be okay, right? It doesn't feel okay. Right? This is a complex, life is hard, right? You don't have to do it on your own though, right? You're not required to just tough it out, right? On your own. You're allowed to ask for somebody else's perspective. It's okay to say, hey, I don't understand what's going on with this and I don't know what to do with it. What are your thoughts? And that's really kind of an important part of therapy, right? I can give people advice, thoughts, directions, but it's not up to me to make you do it. I've taken, I ask a lot of people different perspectives and advice, and, I think about what, some people give really great advice and some people give really terrible advice. So I don't listen to everybody, right? It's not that you should listen to me, right? But it's okay to open that door and see, okay, what are their thoughts on it? Doesn't mean I have to decide to do anything with it, but sometimes even just opening that door of sometimes people just need somebody to vent to, and maybe they don't have any relationships in their lives where they feel that they can do that without some sense of judgment or shame or being told, right? Some people don't want advice at all. Right? They just want to be heard. And so, I'm an unbiased party, right? I can't, I don't want to manage somebody else's life. And so if somebody is just needing to be, heard and vent and talk about their frustrations and get things off their chest, I'm more than happy to be that person, right? And hear where they're coming from. And so sometimes it's just getting the TV idea of what therapy is out of your head, because TV does a very poor job of showing what therapy actually means and what it means to talk to a counselor.
Sure.
Yeah. They present it as very like stuffy.
Yeah.
And like
clinical,
like blah, blah, blah. I'm human just like everybody else.
Yeah.
And so
moving into like maybe the more less comfortable part of mental health is that if somebody maybe doesn't get help, or maybe something happens very quickly, it can lead to suicide or suicidal thoughts. And so what happened? Where do we go from there? Because I'm pretty sure the statistics show that you would think suicide would be more prevalent in the city, but it's very much prevalent in the rural, especially in agricultural community where your life is based on the economics of cows selling or rain falling. So what do we say to our rural community that has maybe suicidal thoughts or is even coping with suicide of somebody else?
And it's, again, very complicated dynamics that occur with suicidality, right? Sometimes I think people have a hard time, in general, we don't like asking uncomfortable questions, right? And again, it's kind of a cultural thing where sometimes we know when we can see somebody struggling and we're, close with them, or, we know them, but we don't want to be rude and we don't want to get into their personal stuff. We're kind of like, mind your own business kind of thing. But it's important to sometimes ask those uncomfortable questions. I'm really good at asking uncomfortable questions because it's like my whole job. It's very, very common for me to work with people who have thoughts of self-harming or have thoughts of death and dying. And again, it's not like as soon as you have the thought, then you need to be committed to the hospital. I think there's a really big fear of like, if I say something about it, they're gonna put me in a hospital, right? And I will tell you, my goal as a therapist is to do literally everything I can physically possible to keep you out of the hospital. Right? I do not want people to be hospitalized. If that is the level that is really, really needed, we'll go there, but it'll be a whole conversation. You will know the full breadth of what's happening, what the expectations are, what's going to happen next, and know through the process, because I think it's something that, thoughts of, even kind of what we call our passive suicidal thoughts of like, I wish I could go to sleep and not wake up tomorrow, right? It's not the same as, I have a plan and I'm going to do it tomorrow, right? Those are very different things. And it's important not for everybody to try to figure that out on their own, but to know that it's okay to reach out to a resource or people, independent or individuals who know what to do next with that, right? And so I think sometimes that even that idea, that fear of like, I don't want to be hospitalized, can keep people from reaching out for resources and talking to people about it, because it's actually not uncommon, right? And I would say it's actually, it's more common that I see the people that I see have had those thoughts at least at some point in time. I would say that's a majority of the people that I've visited with. They've had that thought come up at least once. And so it is something that's kind of very commonly tied to emotional and mental health struggles. But it's not all like absolute, like crazy intervention level, like everybody needs to, panic and high alert and we need to, get them in a straitjacket, right? I feel like that's kind of some of it's more the stigma around it is like it's not that case all the time, and that's where it's like challenging for people, even individuals who have loved ones that are struggling and they know or have heard the individual make comments, like just passive kind of comments that, I just might as well not even be on this earth. It's not that everybody needs to know exactly what to do in that situation, but I think it's something that I've even talked to my family members and my nieces and nephews. They've asked me, I've had several of my nieces say, hey, I have a friend that said this to me and I don't know what to do with it.
Brave of them.
Right. Yeah. And I'm like, I'm so glad you asked.
Yeah.
Right. And I always encourage them. It is not your job to know what to do in that situation. It is your job to care and love them. It's your job to tell them, you're important to me. I want you to be okay. I don't know what to do with this, so I need to tell somebody that can do something or can, that has a little more power in the situation, because especially teenagers, like they don't have power to make decisions for that individual. And so maybe it's telling a trusted parent, telling a trusted adult, and communicating to them, like, I think it's really important that this, we tell somebody who knows what to do with this, right? So, and have it come from a place of love and care. I care about this individual, I care about you. And so because I care about you, I think it's really important we talk to an adult who knows what to do. And so, because I think sometimes, we as human beings feel like when somebody comes to us for advice or says something to us or is struggling with something, we feel like we have to fix it or we need to have the answers, right? And we don't always have that. Mm-hmm. We don't always have that skill set or that knowledge base. And so it's okay to say, I don't know what to do with this. It's okay to say, I have no idea. I'm sorry this is going on. But maybe we can find somebody to talk to, and maybe, if I'm willing to go with them and be part of the conversation, right? Or help them reach out to somebody if they don't know who to talk to about it. And so it's not always our job as individuals in people's lives to know exactly what to do to help them or fix it, right? Sometimes we don't have that. And so I think a big challenge is just encouraging people and not saying, well, you shouldn't think that. Yeah. Right? Telling me I shouldn't think something doesn't help me not think about it.
Yeah. It just makes you feel worse for thinking about it.
Exactly. It's like, okay, there's something, it makes me further turn into myself and go, there's something wrong with me then, right? I'm the problem. I'm wrong, I'm bad, I'm shame, right? Whatever that thing is, right? We start internalizing it. Like, no, I shouldn't talk about it because I got bad feedback the first time. And so I think it's something that just saying, I'm so sorry that you're dealing with this, that can be a huge benefit. Yeah. Being heard again, instead of feeling like they think terribly of me because I told them I had these thoughts. And so again, it's not that the individual in our life had bad intentions. They just didn't know what else to do. They didn't know how to approach that conversation.
I feel like that can be scary when somebody says that to you and you're like, what do I do? And in the moment you just say something like, oh, you'll be fine. Yeah, but everything's fine. It's all right, right? And while the memes of today, it's like the proverbial meme of like, what's that little like dumpster fire in the background? Like, I'm fine. Everything's fine. Yeah. It's burning down, but right? I'm just going to pretend as if it doesn't exist, right? And I think it's something that even if it's not to the degree of suicidality, it's sometimes I think if somebody's feeling really overwhelmed and worked out, or particularly, women are highly emotive, right? That's just how we're built, right? We are more emotive. And many men's famous last words saying, just calm down, not helpful. I think that's something that, like, you want to make me even more mad, right? Or more frustrated with a situation, tell me to calm down, right? You will give the exact opposite response, right? So telling me to calm down as if I haven't already tried that, right? I think that's sometimes a misconception. It's like, if somebody is really overwhelmed and kind of panicking or freaking out, telling them to calm down
is doing nothing. Had they known how to do that, they would have done that already.
So what would you, can you give some suggestions on like some other phrasing or
Yes.
something?
And sometimes I hear people will say, a common one is like, just take a deep breath, right? Well, if somebody is actually having a panic attack or something, trying to take a deep breath can actually make you more panicked because you feel tight, congested, you feel like your throat's closed off, you feel like you can't get a good breath. Yep. So trying to take a deep breath actually can make them feel more panicky because they feel like they can't breathe. So it's not about taking a deep breath, it's just take a slow breath. And sometimes just like being there with them and breathing with them, right? Just keep focusing on this, right? And being with them in that and helping them kind of slow things down a little bit, right? It's not about deep breathing, it's about slowing our breathing down. Right? And so, and reassuring them that I'm here with you, we can work through this, whatever it is, right? Sometimes there may be situations where you can't work through it, right? And so it's just sometimes being there with them, like I'm here with you, that sense of like connectedness, like it's okay, it's okay to not be okay, right? And so.
And just like letting somebody know they're not alone.
Yep.
So what advice do you have for parents that, like I don't remember having so many things on my plate as a teenager, as our kids do now, which is cool because they have so many opportunities, but, there's like homework stress and athletic stress. And then on top of that, we have, these like perceptions of reality that don't exist because everybody's perfect on social media. And so, what advice do you have for parents to help navigate their kids through these like very mentally stressful period in their life?
Yes. And I think it's something that teenagers are difficult anyways, right? Teen years are rough. They can be all over the place because the primary relationships at that point in teenage years are our peers. Those are like the pivotal thing. And whereas technology is neither good nor bad. It has no moral value. It can produce positive and it can produce negative, right, experiences from it. And this is for any technology, right? There's pros and cons to everything. Social media, while it has helped people maintain contact over long distances, right? So I have, I'm old, so I have Facebook. I know it's not the most popular amongst the younger generation. A way to stay in touch with my relatives that don't live near me, right? And seeing their kids grow up or seeing my kids grow up, and sharing that connection with them is a benefit. But with that comes also the negative influence of, everybody for the most part, puts their best edited self on social media. And so when teenagers see, all these influencers, they're living this fabulous lifestyle and they have it completely together and they're so beautiful, right? It sets these really unrealistic standards, right? And I think about it, every generation will experience some level of this. It's just going to look different, right? For, our generation, I think it was more so like the supermodel was really big.
Teen magazine.
Yep, teen magazine, right? And everybody was like super skinny and, again, airbrushed. And so every generation will have some level of these influences and things that they're kind of seeing reality through. And I think it's something for parents to understand that while the challenges may be influenced from something different, the issues are still very fundamental, right? And in looking at, how teenagers look at like how I view myself within relation to other people, right? What are my peers doing? What are, what's important to me? And I think it's something that's really challenging with knowing how to navigate those accesses to information. Information is important. It's really nice to have. I can access, if I'm like, I did this a lot as a mom, right? Of like, okay, this rash, I'm Googling, what could this rash possibly be, right? And so it's important, but it can be really biased information, right? And it's not always accurate information. And so I can't just rely on that. And teaching our kids how to navigate these challenging dynamics and understanding that just because somebody on the internet told you something does not make it true, right? And that sometimes what you see is not real, right? Is especially where the AI is now exploding, right? It's such a challenging thing to go from this dynamic of how we want our kids to understand and be able to function in the world and part of it and know how to utilize these things, but utilize them responsibly and not rely on them for everything, for our sole source of information, our sole source of emotional connection to people, our sole source of self identity. And so it's a kind of a two-way street. Yes, teenagers have some autonomy. They're old enough to make some decisions. But I can tell you, when I was a teenager, sure, I made decisions. Not all of them were great. I commonly reminisce, or frequently reminisce sometimes with my good friends from high school and think, man, how are we still here, right? How did,
there was nobody
right?
recording
Thank
everything.
goodness social media did not exist at the time and we got through it, right? But I think it's something that parents have to be aware that it's not just, and especially younger teenage groups, right? Younger teenage groups, again, the younger you are, the less understanding you have of the world and how it works, right? And so access to anything that has internet on it, right? It's not that we should say, no, you're never allowed to access these things, but we have to, as a parent, we need to be understanding and responsible of we're not just allowing our kids access to the world, but we're allowing sometimes the world to access our kid. And I think sometimes it's easy to, and I am guilty of it as well, right? It's easy to like give the kid a tablet, like, okay, go. Like, give me a little bit of breathing room for a little bit, but understanding like, what is it they're accessing? And are there ways for, people who are not well-meaning to access my kid? And in what way is that potentially detrimental to them, right? It's not my job as a parent to be their friend and to make them happy all the time. And I think that's hard for any parent.
Yeah.
But
it's important to hear.
It's important. Like, I'm not your friend. That's not my job or my role. It's my job to keep you safe.
Yeah.
Right? And sometimes you're going to disagree. Kids are going to disagree with what's safe and what's not safe.
Yeah.
And so it's like, I as the adult need to be the authority in that situation. It's difficult.
Yeah. So do you think though that when kids make their own identity based on what they see on social media and through how they interact with their friends, that like sets kind of their mental health baseline?
I mean, it definitely can influence it, right? And so if I'm constantly comparing myself to, these set of standards that are unrealistic, but I, as a teenager, don't necessarily know that they're unrealistic, right? Because our life experience, we don't have enough life experience to know what's actual realistic expectations and what's really not. So, when we're teenagers, if we're basing, and comparing ourselves, because that's what teenagers do, they compare themselves to their peers and see like, oh, what are they doing? What am I not doing? And what am I fitting in?
Yeah.
Right? And so that's the challenge of like navigating how much influence those things have on teenage development and emotional development.
It's hard.
It's hard. And so I think that's where the role of parents and teachers can be incredibly important, right? Friendships can be really important. And they don't always know how to navigate those relationships, but sometimes, again, what they see on the internet is like, oh my gosh, these people are friends with everyone and everybody likes them and I don't feel like I fit, right? And that can create a tremendous amount of distress for a teenager, right? And feeling like I'm the oddball out. Nobody wants to be the oddball. Well, some people are perfectly fine with being the oddball, right? But most people want to fit into whatever that community looks like, whether it's the school system or it's, their peers or their coworkers, right? We want to feel like I belong somewhere. And if I'm constantly comparing to what I see on social media, that's, again, not always the most reliable resource to compare to.
So in relation to the work that you do, if a parent is having a hard time figuring out how to have these conversations with their kid or just understand what's happening, they can seek out your services too, and you can help walk them through that?
Yeah, absolutely. I love, one of the biggest aspects of things that I see is and work with is how people interact with each other, right? Because it can be complex family dynamics, it can be complex peer relationships, it can be complex work dynamics, work relationships, right? So much of what we do has to do with the way we interact with other people. And I think everybody knows the term boundaries. Very few actually understand what that actually is, because I think people hear the words, I need to set better boundaries with other people. Well, yes, that's a piece of boundaries, right? It's an aspect of interacting with the world. But boundaries aren't just about telling other people no. And I think that that's where the common misconception is. It's like, yes, that's a bit of it, but it's also what are the boundaries I set with myself? What are the things I tell myself no to? And what do I tell myself yes to? And how does that affect the relationships and interactions I have with people? And so boundaries has a lot to do with mental health and how how we interpret or perceive what's going on in our world and what's going on with ourselves, right? Yeah. I love those conversations.
Yes. So if you could, to wrap this up, give one piece of advice to our community at large, whether it's just to be about resources or something, a useful tip, what would you like to say to our community about mental health in Eastern Colorado?
It's okay to struggle. It's okay that things aren't perfect all the time. It's okay to need somebody's input or advice, or whether professional or otherwise, to ask for help is okay. I don't have to do everything on my own all the time. It's okay to seek out information, right? Even if it's just I don't really understand what mental health is, but I want to, I have questions about it. Come ask me questions. I'm more than happy to talk. That's what I do. I talk a lot. But I think it's something that, it doesn't have to be a counselor, right? I think we're one piece of a puzzle, right? It can be a pastor. It can be a really strong, positive influence, whether it's a peer that you can relate to really well, or it's, a podcast, right? There's a bajillion different podcasts out there. I listen to a wild range of podcasts, but there's a lot of podcasts on mental health. So it doesn't always have to be you have to see a therapist. We can find resources. There's never been better access to mental health than there is now. We are at a time where we can access, therapy pretty much from anywhere at any time. That's never existed in the entirety of the world up until now. And so whether it's faith-based or it's a very specific topic of how do I navigate this marriage there's so many things going on, I don't know how to navigate it. There's a ton of podcasts that are just around, marriage. Right? You can really specify the information. And again, it doesn't mean necessarily that you only have to listen to that one source. I think it's good to find multiple sources of what do they say and what do they say and what do they say? And it's okay, now I'm gonna, maybe cherry pick what I'm gonna take away from those things. And so, don't feel that, therapists have to be your only resource. Sometimes we just have to think outside the box.
Yes, I love that. Well, thank you so much for joining us today. And for those of you listening, in the comment box below, we're going to link the phone number that you can call Park Health or Stratton Medical Clinic to schedule an appointment with Krista. We will also link our other local resources like Centennial Mental Health, the Roots Substance Program.
I can't remember exactly what they're called.
So,
some of the private providers.
Exactly, but we just want to make sure that you guys, that we're giving you all the resources that we know that are available in our area. And finally, if someone is struggling with thoughts of self-harm or suicide, then reach out to the National Suicide Prevention Hotline, which is going to be linked right here on the page too. So Thank you again.
All right, well, thank you. I appreciate it.
Bye.